Hey there, amazing people. Welcome to Donut Dental. I'm Dr. Ganesh and I'm here to help you ace the CSCEOSCE exam. Let's get started. Medical conditions affecting dental treatment. The management of patients with medical conditions requires careful consideration and adaptation in the dental setting. In this video, we'll explore various medical conditions that can impact dental treatment, discuss the importance of premedication, and outline strategies for managing patients with specific needs and emergencies. Managing patients with medical conditions. Binge eating. While binge eating itself may not directly impact oral health, it can be associated with other conditions like bulimia nervosa, which can lead to tooth erosion and other oral complications. It's important to be sensitive and supportive when interacting with patients with binge eating disorders and to address any oral health concerns that may arise. Hypertension, high blood pressure can increase the risk of complications during dental procedures. It's crucial to monitor blood pressure before and after treatment and to avoid excessive stress or anxiety for the patient. In cases of hypertensive crisis systolic over 180 and or diastolic over 120 MHE, immediate medical attention is necessary. Diabetes can affect oral health in various ways, including increased risk of periodontal disease, delayed wound healing, and oral infections. It's important to schedule appointments for diabetic patients in the morning after they've eaten and taken their medication. Monitoring blood glucose levels and having glucose sources readily available in case of hypoglycemia, low blood sugar, is also crucial. HIV/AIDS patients with HIV/AIDS require standard precautions during dental treatment. Just like any other patient, they may be more susceptible to oral infections like candidiasis, hairy leukoplakia, and periodontal disease. It's important to assess their immune status and collaborate with their physician to ensure safe and effective dental care. Emphysema, a type of chronic obstructive pulmonary disease (COPD) that can make breathing difficult, especially in a supine position. Patients with emphysema should be treated in a semi-upright position and avoid procedures that generate aerosols like ultrasonic scaling. Asthma, a chronic respiratory condition that can cause wheezing and difficulty breathing. It's important to have the patient's inhaler ready available during appointments and to avoid triggers like anxiety or stress. In case of an asthma attack, administer the inhaler and provide oxygen if necessary. Dementia patients with dementia may have difficulty understanding or remembering instructions, making communication and cooperation challenging. It's helpful to have a caregiver present during appointments and to provide clear and concise instructions. Premedication guidelines. Certain medical conditions may require antibiotic prophylaxis premedication before invasive dental procedures to prevent infective endocarditis, a serious infection of the heart's inner lining. Conditions that may necessitate premedication include prosthetic cardiac valve or prosthetic material used for cardiac valve repair. History of infective endocarditis. Cardiac transplant that develops cardiac valvulopathy. Unrepaired or incompletely repaired cyanotic congenital heart disease. Repaired congenital heart defect with residual defect at the site or adjacent to the site of a prosthetic patch or device. ASA Classifications. The American Society of Anesthesiologists ASA Physical Status Classification System categorizes patients based on their overall health and the potential risks associated with medical procedures. ASA1 normal healthy patient. ASA2 patient with mild systemic disease, example, controlled hypertension, asthma, diabetes without systemic effects. ASA3 patient with severe systemic disease and some functional limitations, example, controlled congestive heart failure, stable angina, poorly controlled hypertension. ASA4 patient with severe systemic disease that is a constant threat to life, example unstable angina, symptomatic COPD, symptomatic CHF. ASA5 moribund patient not expected to survive for more than 24 hours without surgery. ASA6 brain dead patient. Emergency scenarios. Dental professionals must be prepared to manage medical emergencies that can occur during treatment. Some common emergencies include syncope fainting, the most common medical emergency in the dental office. It's usually caused by anxiety, stress, or pain. Treatment involves placing the patient in a supine position with their feet elevated and monitoring vital signs. Orthostatic hypotension, a drop in blood pressure upon standing, often causing dizziness or lightheadedness. It's more common in patients taking antihypertensive medications. Treatment involves returning the patient to a supine position and gradually raising them back up. Anaphylaxis is severe, life-threatening allergic reaction. Symptoms include hives, swelling, difficulty breathing, and a drop in blood pressure. Immediate treatment with epinephrine and activation of emergency medical services are crucial. Hypoglycemia, low blood sugar, often occurring in diabetic patients. Symptoms include shakiness, sweating, confusion, and even loss of consciousness. Treatment involves providing a source of glucose, such as juice or glucose tablets. Hyperventilation, rapid breathing that can lead to lightheadedness and tingling sensations. Treatment involves calming the patient and encouraging them to breathe slowly into a paper bag or cupped hands. Conclusion. Managing patients with medical conditions and being prepared for emergencies are essential aspects of dental practice. By understanding the potential oral and systemic implications of various medical conditions and medications, dental professionals can provide safe and effective care for all patients. Remember, open communication, careful assessment, and preparedness are key to ensuring positive outcomes and a comfortable dental experience for everyone. In our next video, we'll explore the world of dental procedures and products, discussing various treatment modalities, preventive measures, and the tools and techniques used in modern dentistry.